Hi, my name is Dr. Sara Rodgers. I'm from Idaho Naturopathic Medicine here in Idaho, and I'm here with Dr. Kelsy Newton today of St. Luke's Children's Neuro and Behavioral Psychology. Thank you, Kelsy, for joining me.
Thank you for inviting me.
Yeah, so can you tell me a little bit about what you do and who you see?
Sure. So I am a pediatric psychologist here at St. Luke's. So my area of specialty is really working with kids and adolescents with chronic health conditions. And in my role at St. Luke's, I see kids that anywhere from kids with an inflammatory condition to chronic kidney disease to kids with chronic pain. So I will see any kid with a chronic health condition who's seen by one of our medical specialists.
Wow, that sounds like really important work. And you have a doctorate in clinical psychology.
I do.
So you know a lot about children's developmental health.
I do.
That's why I wanted to talk to you today. There's a lot going on and a lot of concern for children these days in terms of social distancing and fear and stress with living at home, maybe not going to school, or the fears of getting sick going to school, or grandparents getting sick, or there's so many things that we have to deal with these days, and children obviously are part of that and they feel it. So I really wanted to talk to you about how children and parents can navigate through this COVID isolation time. So what I'd like to ask you is what sort of tools do you think children or parents need in order to have control over their lives at the moment?
Yeah. I think the first thing that I'll say is that I think it's really important for parents to take care of themselves during this time. So parents have gone from, full-time parents often working full-time, and now some parents are full-time educators. And some parents are still working from home. So they're working from home full-time, they're educating their children full-time, and then they're parents. And that's a lot of
It's
stress.
a lot.
It's a lot. Yeah. So making sure that my first thing I'd say is making sure that parents are taking care of themselves, that, you can't give to somebody else what you don't have yourself. There's a common analogy that we use in psychology of the the oxygen mask in the airplane, that you have to
Right.
put the oxygen mask on yourself first before you put it on your child.
Right.
So as far as control, I think, making sure that kids have some choice, making sure that there's some predictability. So making sure that kids still have routines and adults still have routines. You still have a bedtime, you still get up, you have school at a certain time. If you, prior to COVID, if you got up, you got dressed, you ate breakfast, you still do that at the same time now.
Right.
But also giving kids choices that, if they want, like, do you want oatmeal or waffles for breakfast? Letting them pick their own clothes, deciding what school that they, helping them organize, but deciding what they want to do for school. So giving them some opportunity to have some control over their world, because right now the world is very uncertain.
Right. And I really like this concept of routine, for those of us working at home, the change between being at home and being yourself at home versus going to school or going to work has all become blurred. My boyfriend actually gets up and he rides his bike like he's going to work, but his work is in the house. So it may be like going to walk to school, but really coming home to the kitchen to do your work. Having some sort of connection between the different parts of our lives is important.
It is, yeah. And you brought up another important aspect, is that we used to move a lot more in our daily life. So, especially kids, they get up, they maybe walk to school, or they get taken to school, but then they walk between classes, they have recess. Even adults, we go to the grocery store, we walk the dog, and right now, none of us are moving. We're sitting in our home offices or sitting on video, so we're just not moving as much. So I love the concept of, if your kids walk to school, maybe right now with the smoke, they just walk in the house, but they still get up and move their body a little bit.
Right, right. Right. And this brings up another thing of screen time, because there's a lot of opportunity to find, communities or videos online about getting people moving. I've always, promoted yoga, and even if you can't go to a class, you can find a yoga class online. But that brings up the screens, and that we are all using more screens now. And there's always this concept of too much screen time for kids, and for parents at home that might need to entertain children or distract them while the parents are working. My concern is that children might be getting too much screen time.
Yeah, I share that concern. And especially, I see a lot of kids with chronic pain. And if you think about, you're staring at a screen, you're sitting all day to do class in front of a screen. I think we're going to see an increase in chronic pain just because of our current lifestyle, what we're forced to do. But yeah, I share your concern. I think it's really important that you give kids the opportunity to take tech breaks. So if that's on the weekend, everyone shuts off their phones, you shut off the TV, and you find other activities to do. We have to accept that right now kids might need to spend 8 hours on a screen to do school. But then how do we promote outside, time outside of screen time when they're not on school? The hard part about that too is a lot of people are connecting via screens.
Right.
So just because they're at school 8 hours a day, then maybe they need to and want to FaceTime their friend or their grandparent, because they used to do that. They'd hang out with friends after school. So I think it's just that balance of recognizing that we're doing the best we can as a society, and that means more screen time.
And for those of us in the West, it's made it even worse when this fall we've had that huge amount of fire smoke where it's been dangerous to go outside. And now we're cooped up even more after a year of being cooped up. So that doesn't help either. I mean, my release has always been to go outside, but when you're cooped up because it's too dangerous to go out, and that's another stress on the whole situation. So do you have any suggestions about what kids can do or parents can do to help reduce some stress in their lives?
I have lots of suggestions
about that. Great. Let's talk about them.
Yeah. I think, again, talking about screens, there's a lot of really good apps out there for relaxation and meditation and mindfulness. One of my favorites is called Smiling Mind. It's free, and it was developed by psychologists and educators. And it's broken down by age ranges too. So it's been developed for kids, and then I think it's comparable to some of the meditation or mindfulness apps that have a subscription fee, but it doesn't have a subscription fee.
Nice. So if you're going to assign some extra screen time, that would be one of the things. If there's going to be some screen time, that this would be a helpful way of using screens.
Yeah, and you can just turn it on and put your screen down. So
nice.
A record or an audio recording, so you don't have to watch a video. So I think as a family, getting into mindfulness or some deep breathing or some way to relax your mind and body. I have a small child, and we were watching Sesame Street the other night, and I think it was Elmo who was describing how he was playing that he was outside inside, so he turned on a lamp and described it like it was the sun. And so being creative in the ways that noticing your surroundings, but then how can you connect with nature even inside, or use your imagination that you're outside,
or even take it further and creating a little terrarium, or finding some seedlings that you can plant or something like that. There's something about plants that is very calming.
Very, yeah, yeah. And again, thinking about mindfulness and relaxation, then if you're growing a plant, using all 5 of your senses to plant the plant or look at it, describe it in detail, and just helping, I think it really helps give both kids and adults that mental break, where they're not thinking and worrying.
Right. And I try to do something even on really stressful days, even though it's kind of hard on very stressful days, is gratitude. And I think we talked about that a little earlier, about remembering all the things that you do have in your life.
Mm-hmm.
So when stress does get high, having that gratitude list is very helpful, and remind yourself about that.
Yeah. I recommend making a ritual out of gratitude. So, at the dinner table, everyone going around and talking about one thing that they're grateful for that day, doing it at the breakfast table. When you can get outside, doing it on a walk, just some way as a family really being able to share what you're thankful for, because sometimes it's really nice when
Right.
you have one thing you're thankful for and then you get to hear all the other things.
Right.
It expands your own gratitude.
Right. You're like, wait, I want to be grateful for that too. And I when I did my little pre-interview with you, you talked also about empathetic listening for parents.
Yeah. So as I admitted, I'm a parent of a small child, and so I think what I really learned about becoming a parent myself is that it's very uncomfortable and distressing when your child is in distress.
Mm-hmm.
And so I think as parents in general, we want to make our child feel better. What that ends up sometimes is that we rescue our children and we don't let our children experience their own distress. And so by just sitting with a child and listening to how they're feeling, and sometimes naming how they're feeling, it gives them the opportunity to feel heard. And then also, you're not trying to solve their problem. And it's amazing when you give children the opportunity to solve their own problems, or when you ask for permission to help them solve a problem. But just by letting them know that you can sit in their discomfort and their distress, it makes it manageable. So if we can, I think it was Fred Rodgers who said, if you can name it, or if you name it, you can deal with it. So
nice. I love how you named both Sesame Street and Mr. Rogers within a 5-minute period. That's lovely. Yeah, and in my practice, I use a tool from the Center for Nonviolent Communication where they have a list of feelings and needs. And I find that it's really helpful for adults to use that. But when I've used it with children, it's been pretty amazing too, because the parent's sitting next to them. And when the kid's like, well, I'm feeling this because of this, the parent has had no clue that that's been going on. And so it is a really powerful tool to listen and to understand what a feeling is, and that feelings have no judgment. We can judge feelings because this is just how you feel. And usually the way that the Center for Nonviolent Communication model is you have feelings because there's needs that are either met or not met, and so that you help people figure out what their needs are.
Right. Yeah. And I also think that all emotions have a purpose, and so understanding that emotions aren't dangerous, that they're a normal part of your human experience, and that they're telling you something, and then it gives you the opportunity to respond the way you want to, instead of just reacting without recognizing how you're feeling. So I think parents giving their children the opportunity just to be listened to is also very, very helpful.
Right, and it's a way to connect with your child.
Yeah, and it's a way to connect face to face. If we're worried about screen time, it's a way to just, you turn off the screens, you sit down, and you listen for a little bit.
Well, these all sound like great tools. Do you have any red flags that parents should look for to be able to assess whether the kid is stressed out whether their child is really stressed out.
Yeah, yeah, yeah. I think I just want to normalize too. I have just seen more stressed kids. So, you know, I've been doing this work for a decent amount of time, and I feel like I am seeing what I would consider more parents who are reporting that their kids are more irritable or more cheerful or a little bit more clingy. And I think that that is all, I would anticipate all of that right now because the world is very uncertain. Big red flags for me would be like a school age child that has been potty trained for a long time and is now wetting the bed. Kids that are having like violent outbursts where they're hitting and kicking and screaming, which is not would be atypical for a kid, so not something that they normally did. A kid that's again not normally withdrawn, that's extremely withdrawn. I think uh, teenagers sometimes talk back, but a teenager who maybe is not following the household rules about social distancing, is staying out late with friends, engaging in erratic or behavior is something that I would be concerned about. I think again we are seeing. I am concerned about depression in our society in general, but I think if you're talking to your kids and creating a space where they feel like they can tell you how they're feeling without freaking you out, you're going to be able to pick up, if they're really depressed.
Right.
If you're not talking to your, go ahead, Sarah.
Yeah, and then those listening tools you talked about, engaging with your child, maybe doing a little more exercise, and maybe finding ways to socialize safely.
Yes, ways to socialize safely. Yeah. I went to a presentation in the midst of COVID, and they were talking about one of the beautiful things about summer is that we had things to look forward to. So, concerts on the lawn or sporting events, and just the act of scheduling pleasant events can be really helpful. And so it's not something that we can still do that. We just have to be more thoughtful about it.
Right. And scheduling Thanksgiving, that sort of things, like how to figure that out. I'm working on that, of trying to figure out how to do that really safely.
Right.
Without doing a Zoom Thanksgiving.
Right. But that social connection.
Right.
Yeah.
I think that just timed this video. It just like, this is dated now. We're in COVID before Thanksgiving. Everybody will know when this is done. Yeah. Well, Dr. Newton, this has been fantastic. Do you have anything else you would like to add or discuss?
Yeah, I think the one other thing I would just like to add is that I also, thinking about coping, there's a concept called self-compassion. So it's treating yourself as if you would treat a friend or a loved one.
Right.
And part of it is acknowledging that as human beings we suffer, and that there's common humility, so that all of us suffer, and that you don't have to be perfect. And I think I encourage parents definitely right now that to give yourself some self-compassion, and then kids as well, that we have kids who aren't doing well learning online, and that's okay. It's a whole new ball game. Or kids who are more irritable or more anxious, and that's just part of what we're all experiencing as a humanity right now, and that to give yourself that compassion, that it's okay to feel however you're feeling.
Right. These are difficult times.
Yeah.
Well, thank you so much for talking with me today. We'll be posting those resources you talked about at the end of the video, along with the link to the feelings and needs in nonviolent communication, and any other resources that you wanted to add. So thank you so much for your time today.
Thank you. I appreciate being here.
Yeah. All right.